Welcome to KHQA's Healthcare Marketplace Now. I'm Carol Sowers, and for the next 30 minutes, we're going to talk with some experts about the Affordable Care Act, how it will affect you, and what you need to do to get ready for the changes to healthcare access. A distinguished panel of guests is here in our studio with me to help walk us through this process. Jim Duffett is here from Champaign, Illinois, representing the Campaign for Better Healthcare. Todd Ahrens is the CEO of Hannibal Regional Healthcare System in Missouri, and Kenny Boyd in Macomb. Thank you to all of you for joining us. Starting October 1st, you can start buying health insurance under the Affordable Care Act. That's less than 2 weeks away. Now, you can do this through the Health Insurance Marketplace, but polls done as recently as this week show that people who do not have insurance now do not understand that the law requires almost all of them, with very few exceptions, to get health insurance, let alone how to go about getting it under this new system. So what is the marketplace and how do you use it? KHQA's Chad Douglas shows you the way.
The Health Insurance Marketplace is set up to be your one-stop shop for health insurance. You buy your insurance at the state level, but most states partner with the federal government for now. The website is healthcare.gov, and it's open to anyone, even if you're already offered health insurance at work.
Go look at healthcare.gov now. Go start exploring it and see, because you will learn a lot right now, because a lot of the information that I've talked about is out there. And there's some tools that are already out there to help people prepare.
On the site, you can take a short questionnaire to see if you qualify for financial help from the government in buying your health insurance. Please note, this health insurance is not free. You can start buying insurance on October 1st. Now, in order to avoid paying a fine, you have to buy your plan by December 15th.
All of the plans that will be on the health insurance marketplace must provide 10 essential health benefits. There are different levels you can choose from as far as coverage.
There's the bronze plan, the silver plan, the gold plan, the platinum plan, child-only plan, and catastrophic plan.
The more insurance you have, the higher the premium will be. For example, the bronze plans may cover 60% of your healthcare costs, silver 70%, and so on. Now let's talk fine.
The way the regulation works is that you will be fined each month on a prorated basis that you do not have insurance.
The law says the penalty will be the greater of a flat dollar amount per person or a percentage of your taxable income. In 2014, the flat amount is $95 per adult and half that for a child under age 18. Each year, the penalty goes up through 2016. Now, some people will be exempt from having to have insurance. They include those who don't make enough money to file taxes, those in jail, or undocumented immigrants. Chad Douglas, KHQA News.
We're going to turn to our panel now. First, Jim Duffett with Campaign for Better Healthcare. Will this be ready to go October 1st?
Oh, absolutely. And there'll be a website. There will be counselors out in communities, and people will have a good 6 months to be able to figure out what plan that they would like to have for themselves and or for their employer.
Okay, well, that's good to hear. That's a good starting place, at least. From October 1st to December 15th is not much time for these enrollments. Do you think this can really happen in that amount of time?
Yes. I mean, those of us who have private health insurance, we have a small window of opportunity for our open enrollment, and people will have a good solid 2.5 months to at least be able to be ready in January. But if they don't, they can still sign up in January, February, March, and still get health insurance for the rest of 2014.
Even though we talked about fines and regulations in that last story from Chad Douglas, there is going to be some leeway, because this is the beginning of this whole process, correct?
Absolutely. I mean, this is like merging a Mac computer system with a PC computer system. I mean, there will be hiccups. This is the largest implementation of any type of social insurance program in the country's history.
All right. Thank you, Jim. Now, Todd Ahrens is with Hannibal Healthcare System. Kenny Boyd is from McDonough District Hospital. What changes have you had to make in your organizations as part of the Affordable Care Act and preparing for it? What changes will I notice if I'm a patient coming into your hospital? Todd, let's begin with you.
Well, Carol, first of all, our organization as a healthcare provider is mostly concerned about this implementation from a revenue or reimbursement perspective. We're expecting a significant reduction in reimbursement as a result of various aspects of the Affordable Care Act and some other legislation that's been adopted in the last 6 months or so. So Our organization is looking at ways to become more cost effective, trim some of the expense out of our healthcare system so that we can offer the same book of business on a going forward basis with less reimbursement from the federal government.
So, Kenny, what kind of changes am I going to notice if I walk into McDonough District Hospital after this really takes effect?
Once it takes effect, as far as noticing a difference, most patients should not notice a difference. The biggest change would be for patients that possibly did not have insurance before and hence do now, therefore providing them access to covered health services like others that already have health insurance. So they would notice a major change in how they access the facility or services that they may need.
Okay. What will the Affordable Care Act cost, both for healthcare providers and you? More from our panel of experts when we come back. And be sure to check out our Healthcare Marketplace Now webpage, chock full of information at our website, connecttristates.com. Welcome back to Healthcare Marketplace Now here on KHQA. It's time to evaluate your healthcare insurance. In less than 2 weeks, the Affordable Care Act will give you the option to choose which plan is best for you, regardless of your job, pre-existing health conditions, or income. Open enrollment in the marketplace begins October 1st. KHQA's Brooke Hash breaks down the costs and tells us why some feel it could actually break the bank.
Beginning on January 1st of next year, an estimated 30 million Americans will have health insurance previously denied to them for a variety of reasons. Some health providers and the federal government disagree about what it will cost to insure the previously uninsured.
The most expensive place to go to seek health care is to an emergency room.
For nearly 50 million uninsured Americans, the ER is their only option.
And they have to receive care. Those hospitals receive federal money for charity care to help pay for that care for the uninsured.
The federal government says the Affordable Care Act will not add to the federal deficit, but rather shift the funding to better uses.
If we are reducing the number of uninsured by 20, 30, 40 million, we don't need all of that federal dollars for charity care. That charity care dollars are being shifted to help pay for things like the tax credits, the subsidies, Medicaid expansion.
In the end, it's so worth it to have people able to sleep well at night, knowing that they won't be hit with a medical bill that could take them under.
Amy Whitcomb-Slemmer comes from Massachusetts, where 96% of its residents are insured. The state implemented a law similar to the Affordable Health Care Act back in 2006, signed by then-Governor Mitt Romney. She said many people then voiced concerns about the potential for insurance rate spikes.
Health insurance rates actually went down so that individuals and some small businesses had significant savings based on the fact that there were more people to insure and they had access to better services than what they had before we implemented the law.
Slemmer says the state is just now starting to see a difference in the number of ER visits. She expects that number to drop significantly with more reform in the state's healthcare delivery. That would include additional walk-in clinics and longer hours at the doctor's office. But not all doctors agree this will work.
You'd like to believe that you're going to reduce the number of emergency room visits, you're going to reduce length of stays, you're going to actually keep people out of the hospital, which is going to reduce costs. And some of that will happen, but I just don't know whether from a bookkeeping perspective it's going to really balance it out.
Dr. Linton Johnson with the Hannibal Clinic says it could cost some physicians their jobs.
You are seeing nationwide significant consolidation of health care. You are seeing a significant reduction in the number of private practice physicians in this state as well as in many other states. And what's happening is you're getting large systems, hospital systems and multi-hospital systems, which are really becoming the dominant players in healthcare.
Analysts say it could take months, if not years, to realize the total cost of the Affordable Care Act.
Now, the question that I have for you, Jim Duffett, with the Campaign for Better Health Care, it's so important that people know about all of this. Your organization's putting boots on the ground, operating a campaign almost like a political campaign, in some cases door to door. Employers are required to let their employees know, but there's so many people. How are you going to prevent some of those from slipping through the cracks?
Well, I think some people will slip through the cracks, but I think as an aggressive media campaign that the state of Illinois is going to do, I think all the insurers are also going to be doing media campaigns, because here in Illinois they've got 1.2, 1.3 million people, new customers that they can get. All the providers are going to be doing education, and for those who have access to website, I mean, it's going to be like Travelocity when you try to find the best hotel or what hotel fits your needs, or other sources. And then there'll be places that people will be able to go to, the public health districts, hospitals. I know we'll be doing things at public libraries to kind of do one-on-one counseling with folks.
So even though we're not seeing necessarily a lot of information out about this yet, we are going to start seeing a lot in the next couple of weeks, I'm anticipating.
Yes, I mean, open enrollment begins October 1st. And for the next 6 months, there's going to be a slew of information that will be out there for people to be able to look at, come here, get questions answered, go back home, sit around the kitchen table with their family, assess their healthcare needs, and have choice, and be able to pick, what plan that they feel meets their budget and their healthcare needs.
One of the points of the Affordable Care Act is to get people involved in taking care of themselves before they have to go to the emergency room or end up in the hospital. We talked about that in the story very briefly. That's going to mean more checkups, more tests like mammograms and colonoscopies, more emphasis on managing chronic problems such as diabetes, for instance. So Todd and Kenny, how are your facilities preparing to handle more people using the system for these kinds of checkups?
Well, Carol, one of the things we're focusing on is health, not just treating sick people, but trying to keep them healthy, keep them out of the hospital in the first place. We think that that's where healthcare is going from a reimbursement perspective. So right now we're focusing on our own team members. We have a group health plan that, for which we're self-insured, and we're going to look at the participants in that health plan and try to find ways that we can reduce the cost of the health plan by meeting our mission of keeping them healthy. And if we're successful in that, we may make that something we offer more widely within the community. Because I think you're right, healthcare is going to become more focused on health as opposed to just treating those individuals that are acutely ill.
Right. One of the things that we're hearing, Kenny, is that it's likely eventually going to be less staff in acute care, more in ambulatory care, and higher use of the ER has been a contributing factor to these rising healthcare costs. All of this is designed to help prevent that. Do you feel confident that McDonough District Hospital is ready and that this is going to work the way it's supposed to?
Well, we hope it would. It's been, for years, we've tried to figure out how to keep people out of the emergency room and get them into primary care settings, because it is much more efficient. It's more efficient for the system and it's less costly for the patient. And all in all, that relationship with the primary care physician leads to better health. When we look at our ensuring that we have the right mix of physicians and providers in our communities, we are focusing on ensuring we have the right number of primary care physicians and nurse practitioners and physician assistants, so that patients can get access to primary care, develop that relationship, and work with those individuals to help maintain a healthy lifestyle, manage chronic disease processes. And like Hannibal Regional, we're also working with our employees internally, working with them on employee wellness programs so that we do focus on the wellness piece. So do I think we'll be ready for it? We're hoping so. We've planned, we're pushing towards that piece, but primary care and access to regular preventative services will be the key to making the act work as it is intended to.
All right, thank you. We're going to debunk some about your future health care when we return with KHQA's Healthcare Marketplace Now. Remember, check our website, connecttristates.com, for more information about the Affordable Care Act. A lot of misinformation about the Affordable Care Act. KHQA's Stephen Johnson takes a look at a few misconceptions and reports how they could affect your health care coverage.
For many people, one of the big challenges to getting health care coverage has been pre-existing conditions. Under the Affordable Care Act or the ACA, pre-existing conditions will no longer be a problem.
So if you have asthma, if you have diabetes, if you have a child who has developed any kind of chronic illness or a heart condition you've been diagnosed with, it's illegal now to not let somebody purchase health insurance. They can now be covered. So pre-existing conditions are no more.
Another common question is, do I have to change my insurance if I'm already insured?
And if you have insurance through your employer, you don't have to worry about the marketplace. Anybody can go on and sort of shop and compare prices, but most people that have employer-based insurance are going to stay with their employer-based insurance.
We also spoke with Amy Whitcomb-Slimmer, the Executive Director of Healthcare for All for Massachusetts. About 6 or 7 years ago, that state created a statewide healthcare plan under then Governor Mitt Romney. Slimmer says that one of the biggest worries in her state was whether employers would stop offering health insurance because a publicly funded insurance would now be available.
In Massachusetts, we actually saw the offer rate increase. So more employers now offer their employees health insurance than did before we implemented health reform in our state, because they know it provides them with a competitive advantage.
Slimmer also says that contrary to many expectations, health insurance rates actually went down in her state.
So that individuals and some small businesses had significant savings based on the fact that there were more people to insure and they had access to better services than what they had before we implemented the law.
Now, these are just a few of the questions and concerns that have already been raised over the Affordable Care Act. To start your search for answers, go to our website, connecttristates.com. For KHQA News, I'm Stephen Johnson.
Now we're going to elaborate on some of the common misconceptions and answer some concerns that perhaps you are hearing our expert panel. Let's start with you, Jim Duffett, with the Campaign for Better Healthcare. As you're putting boots on the ground, what are people really still confused and worried about?
Well, the IRS, I'll have to give all my bank statements over to the IRS that when I turn 70 and I'll have 5 years of Medicare, I won't be able to have any procedures. I mean, it's the same lies going over and over again. So there's definitely been a very successful campaign by the anti-Obama folks on Obamacare to scare people into fear, which then, you know, people will step back and not move forward to be able to get insured. So I think it's going to take several years for us to get up to that 1.2 or 1.5 million people. But I think as more people share their stories and experiences, you'll start seeing more people feeling much more comfortable with the expansion.
Kenny and Todd, in your facilities, if people have these concerns, it's probably only going to manifest itself in your offices at local hospitals and other healthcare providers, because if people are confused before they even get there, the confusion may not, be alleviated when they step into a hospital or a doctor's office. So what kinds of things are you hearing? What kinds of things are you doing to try to ease some of the anxiety as we go forward? Kenny?
We will have certified counselors in our organization that will help individuals walk through the process. They won't be able to recommend plans, but they'll be able to help people understand the process, where to go to get the information, how to sign up, what it means for them. We also answer questions on a regular basis with individuals, education to our staff and medical staff on what that means. And some of the biggest concerns are, am I going to lose my insurance and then have to sign up all over again? Is this going to drive up the cost of health care? Am I going to have to change doctors? Is a big question. Am I going to have to go to a different facility, not be able to go to where I normally have come? So a lot of it is just ensuring, as we hear those things come up, that we address those issues as soon as we can with the correct information, or provide the access to the spots where they can get that information.
Todd, what about you and patients in Northeast Missouri?
Well, and I think we'll do a lot of the things that Kenny and McDonough District Hospital are going to be doing, as well as helping patients navigate their way through those processes. Probably one of the biggest concerns we're facing, which is different than my friends here in Illinois, is the expansion of Medicaid in Missouri. The Supreme Court case left that to the states to decide whether they were going to expand those eligibility requirements. And so, we're in a situation in Missouri where there's still going to be a lot of people that are not going to have the resources to acquire insurance through the exchanges, which Medicaid under the original law would have picked up coverage for those individuals. So that's still a big bogey out there for us. And there's going to need to be some legislative help to get some of those things through. The law allows the provision of subsidies to help individuals of certain levels in relation to the federal poverty level to get some assistance making these premium payments. And so on the Medicaid issue, some people that will make less money than others who would be entitled to a subsidy within the law. So we still need to work on some of these issues, and I'm confident, or at least hopeful, that our legislators in Missouri can do what we need on the expansion of Medicaid.
All right, thank you. We will be back with more in just a moment. I've mentioned our webpage dedicated to this topic. Here's a look at it. We have some great information there for you about the ACA and the marketplace. Of course, you can find that at connecttristates.com. And we will see you back here for KHQA News at 6.